Despite 2 congenital heart conditions, nurse Jenna Reish loves to run.
I was probably usually doing anywhere between like 40 miles a week or so. And yeah, it was just a huge part of my life.
So when the 35-year-old started to struggle on her jogs, Jenna says she sought help from numerous doctors, several of which she says dismissed her symptoms.
I actually had one of the doctors say that for a nurse, I seem to have a really difficult time explaining my symptoms. And I was so insulted by that, because if there's anything I pride myself in, it's the fact that I can explain my symptoms really, really well.
A new doctor who did extensive tests found she needed heart surgery, which Jenna says saved her life.
Every run I went on could have quite literally been the thing that ended my life. And that is so scary to think about.
Medical gaslighting is the term used by some patients who say their symptoms are inappropriately dismissed as minor or dismissed as psychological. Up to 12 million Americans are estimated to be misdiagnosed every year.
Unfortunately, women and people of color are more likely to experience gaslighting from those who are supposed to care for them. And some patients begin to accept this mistreatment as the norm, and some distrust the healthcare system as a whole, and then are less likely to even seek care when they need it.
On average, some studies suggest women are less likely to receive the care they need, like less likely to get basic tests for a heart attack. Multiple factors could contribute to differences in healthcare among people of color, including unequal access to healthcare and potential biases among medical providers.
If someone views a patient as of a lower class, or that they will not follow up, based on their race, this can then influence what they then do for that patient. They may be less likely to prescribe a certain medication for them or refer them to a specialist.
What makes you want to speak out about this now?
I feel like it's my purpose to do this. If you are a patient and you feel like you're not being heard or you're being disregarded, that you deserve to seek a second opinion. You deserve to get the care that you need.